closing plenary, Dr. Melissa Limbrodowski. Melissa is the Deputy Director for the Office of Early Childhood Development at the Administration for Children and Families. In this role, she provides leadership and guidance to support early childhood initiatives across ACF and with federal partners and other stakeholders. She has over 20 years of experience working in the field of health and human services. So without further ado, I will turn things over to Dr. Melissa Limbrodowski.
Great. Hi, Julia. I was getting nervous. I was like, oh no, you never ask people to really read those bios when you send them. So anyway, thank you so much. I'm so honored to be here. I'm jealous. My favorite coffee is actually from Atlanta. So Cool Beans Roastery, I actually ordered from there. But anyway, just really pleased to be here. I've been around family support, child abuse prevention, strengthening families work for a while. It means also I'm old, but Filipinos age really well. So I think that's okay. One of the things that I would say about our office, early childhood development, our mission is really to act as a catalyst to support collective impact and support early care and learning of children. So in a nutshell, what we do is really partner across federal offices, with public and private partners. I know that's everything that all of you are doing, so I think we're probably kindred spirits in that way at the federal office. And I'm just so grateful, Andrew and Kaylin, when they reached out and asked me to moderate, I just really felt truly honored to be here with old and new friends. I was talking to Kathy earlier about, I met her when I first started my job at the Children's Bureau almost 18 years ago. So anyway, it's just been a wonderful journey and I'm so excited. Congratulations. It sounds like it's just been a fabulous conference for all of you and I'm thrilled to be here. And I'm honored to be part of this amazing panel of leaders really in the United States and Canada. I think you also have their bios, but I will just share their names with you and introduce you to them first. Debra Armstrong is the Executive Director with the Southwest Resource Center. She's waving in Calgary, Alberta. She's also on the Board of Directors for Families Canada and the Board Secretary there and on the membership committee. So many of you may know her. Takoria Jones. She's a parent leader and advocate from South Carolina and with the Birth Parent National Network with the Children's Trust Fund Alliance. I've truly learned so much from Takoria after meeting her this year. I know you'll really enjoy hearing from her as well. Mark Kling, who's the Executive Director of the Colorado Family Resource Center Association. He's also on the National Family Support Network Steering Committee, I think as you know, and chairs the membership committee. So probably all also familiar with them. I want to also say just shout out to Colorado because I know with the Children's Bureau work around strengthening families, they're one of the states to do the Thriving Families. I know Mark's probably very involved in all that work, so that's pretty awesome. And then Kaylin O'Connor, Senior Associate at the Center for the Study of Social Policy, really leading a lot of strengthening families work. I remember Kaylin when she was in Wisconsin, so that's how way back we go, which is really, really awesome. And then of course, Kathy Wolf, who's really the founder and the president of Be Strong Families. And again, I remember Kathy before she was in that with Family Support America. So just so wonderful. I was asked to just do a little bit of framing before we jump into this really, I think, important conversation. And thank you to all of you. Friday afternoon, you guys are committed, which is really, really awesome. So the first part is learning from 2020, right? And I think what we can't ignore is obviously this has been a year of crisis. It's the year of the pandemic. I think we're all gonna have to, we'll all probably go BC before COVID. We remember what our life was like, and then AC kind of after COVID. So, but I think everyone was impacted. And I think the reality is, and we all know with the data, communities of color, especially Black, Hispanic, and Native American families were especially impacted by the infection rate, their overburden, the mortality rates. the economic situations, because many of them are essential workers. I think all of you know this all too well, that by all measures, their rates are so much worse than some other families, and really the hardships that they're facing. And I think we know the other pandemic is around the pandemic of structural racism that's been happening in those conversations, as you all know, that I think have shown the light on things that have always been existed. But I think in some ways it's also a moment, because there's so much attention to all these issues that we have to seize that opportunity, and really those renewed calls for equity in our planning, in our policies, in our work. And I think I really, really appreciated even Andrew's. I had to ask him for his slides on equity, because basically, right, it's this sort of unequal playing field that people start with, but then this whole, the fences that are up there. I think it was even Takoria was saying, gotta like take down those fences. So anyway, I think part of that conversation is about the response and looking ahead, and family support, and the whole field has been absolutely instrumental in all of that, really recognizing that everyone needs help. It's kind of like a basic premise of it, and that there's tremendous power in helping each other. And the family support field, I think, is well positioned to be doing that work, because you're really have always used those principles of building on family strengths and partnering with parents to be responsive. And so part of this discussion that we're going to have is around, well, what happened? What are the lessons learned? And what do we want to do looking forward? And just really, really excited that you'll have a chance to hear from some amazing leaders about the work that they're doing and what they're thinking. And what we want to encourage you is you be part of this conversation and chime in as well. What are your lessons learned? What are you hearing? So with that, I'm going to go ahead and start the conversation, and really excited to engage with all of you in this. But the first question that we have, and I really thank, actually, I'll have to say the planners for these really great questions. What is, to the panel, what is one lesson you've taken from the response to the pandemic that you believe should help shape our work in the future? And I wanted to toss it over to Takoria first to be the first one.
Absolutely. And I do apologize. I've gotten a notice that says there we can start video. So you can see this fabulous Myrtle Beach shirt. I wore this for my Canadian friends. It's a urban myth, maybe, that a lot of Canadians come down to Myrtle Beach. So I just want to give y'all a shout out. Thanks to Georgia for hosting this wonderful event. Big thanks to the Children's Trust of South Carolina that first helped me start my journey this far. And also to Andrew and Julie. If y'all haven't thanked them at least once during this conference, please take some time to thank them for their hard work and dedication. They are amazing people. So what one lesson have I taken? Well, I'll start with that we are all impacted by the decisions of others. And I think we just need to take a moment to think about that. So, you know, there was a collective response also of quarantining. So we learned that we needed to wear masks to protect each other. And if you didn't wear a mask, that you might cause harm to people who had no way of protecting themselves. And so I really think we should think about that and apply that as much as possible, because together we will. There's no other way to make this work other than together. Another thing I learned from this was the use of shared language and how important and vital that is. You know, in the pandemic, we really had to get down to the business of stopping it. And one of the ways that we learn how to stop, you know, we are in the process of doing that, is this shared language, like social distancing. In my neighborhood, it's not COVID-19, it's the Rona. You know, it's a shared language we have. It's a thing that we do. But that is something that we all, as global citizens, have learned in this very brief, shorter time. So again, that is everything we do. We are all impacted by the decisions of others, and there is a capacity for collective response, as well as the importance of shared language. And when I talk about shared language, I also want to talk about strengthening language, I don't want to not take the opportunity to do that. So, for example, referring to communities as poor is not the best wording. You want to say communities living in poverty or communities dealing with poverty issues. Also, as a parent leader, the word professional kind of gives me the heebie-jeebies sometimes, and I prefer the word agency representative or organization representative, as it takes away the titles and it puts us all at a better equal playing field with equity, of course.
Great.
Um,
Thanks,
that's
Chicoria.
it.
And you had noted the global kind of situation. I'm curious from the Canadian perspective, Deborah, if you wanted to chime in about your lessons.
Yeah, thank you. Thank you, Melissa, for also inviting me to share the lessons I've learned over the last 6 months. I don't think in Canada it's much different than it is to our southern neighbors. But I've had time to reflect on the various ways COVID has impacted the families we are seeing. And without question, lives have been altered in ways we couldn't have even imagined or prepared for. And as always, the challenges are easy to identify. And we are seeing more parents feeling isolated, and many don't have the same support systems that they had before. And the opportunities to meet more people are often much harder. The feelings of isolation and stress has been the #1 reason people are reaching out to our social workers. And more than ever today, we are needing the emotional support for many of them. Like our friends to the south, we are seeing people who are tired of this lockdown and unable to visit with others, unable to go to work and have lost their jobs, unsure how to make sense of this back to school stuff. And yes, indeed, people are stressed. If you have other things happening in your life, this can all be overwhelming. Today, connection is so important. So what did we learn? Well, I actually think our opening plenary, Dr. Robert Sege, I apologize if I'm not doing his name any justice. He spoke about the balancing of these negative experiences with hope and adversity and resilience. So let's look for the strengths and possibilities in others. We have learned that most people and families are resilient, and it's only a few that require the support of intense conversations. Most people want to engage, and the conversations don't have to be with professionals, but they need caring people in their community to provide a listening ear. We have learned it's important to reach out to your neighbors, especially those who are living in vulnerable situations. We all experience life challenges, but we each have strengths. And I want to thank Dr. Sege for reminding us of this.
Great. Thanks, Deborah. I wonder, Kaylin, if you could chime in, and then, Mark, sort of the national, state level, and you're bringing in Kathy as well into this conversation. So.
Thank you, Melissa. I think I totally agree with the lessons that others have already shared. And so to add to that, I would say I think we've learned that our systems can be more responsive and flexible than we've been told they could be before. When the need was massive and immediate, our systems, especially at the local level, more so than state and federal, but our systems have been able to flex. They've been able to say, okay, we'll make sure that, we're not going to worry too much about eligibility or, judging people's eligibility by income from last year is really meaningless right now. So we're just going to make sure everybody gets what they need. Some more flexibility around childcare rules and regulations in order to pay subsidy for enrollment rather than attendance, that kind of thing, that are things that people have been pushing for a while, and that there were always these barriers to just making those changes. We found during the pandemic that we could make those changes. And so I hope that teaches us that we can make those changes going forward too, that we can really think about what families need more than how our systems and funding streams are lined up. And the other thing that I think is impossible to ignore, as we've all mentioned, is the disparities in our society that if anyone was in denial or ignoring them before, it's really, you can't anymore. So thinking about, of course, the racial disparities that became very clear, and that a lot of us knew were there before, but seeing the disparate impact of the pandemic, both in terms of health and in terms of economics, it's just undeniable. And so the lesson learned is we need to do something about that. We can't just be neutral in these questions, and we really do need to take an anti-racist approach, not just you know, colorblind or saying everyone gets everything. And so and those are the things I wanted to focus on as lessons learned, and I'm excited to hear what others are going to share too. Thank you.
Great. Mark, did you want to say from your perspective from Colorado and work you're doing?
Yeah, what we think a lesson learned is the importance of having an existing and respected family support network that funders and stakeholders feel comfortable with to get emergency services to a large number of families in an emergency like a pandemic. And it was, you know, you hate to be in this position, but it was really nice to know that all of these networks that we've worked with, all of the systems that we've worked with, they wanted to work with an organization that was throughout the state, and we have 32 family resource centers in our state of Colorado. They wanted to make sure that as they rushed assets and things like formula, diapers, wipes, you know, food, rental assistance, things like that, they were looking for networks and systems that they could plug that right into. And we were very fortunate and grateful that they chose our family resource centers. You know, we always wonder, if you build it, will they come? And we found out that that was true, that by building a respected network and actually utilizing the quality standards that the national network has, by utilizing our Colorado Family Support Assessment and other tools that have proven to work, a number of funders said, we want to unleash our assets through a network that we respect. And we primarily look at the work we do as being prevention, but they also knew that we could unleash these emergency services immediately. And at the same time, those families that needed those services, if they needed some additional prevention services, they could get those from family resource centers too. And I think that's what makes family resource centers really unique and different. If we can't do it ourselves, we refer out to people who can, and we work with those families over time to make sure they become more self-reliant.
Great. Thanks, Mark. I think it just so well positioned to be this adaptive to this situation. It seems to me is that network for sure. Kathy, share with us from your perspective, your lesson learned. I think you're on mute for a second. Thanks. You're saying something fabulous, I know.
I didn't think I muted myself. And I just wanted to say, you know, I'm listening carefully to everybody, and I think there are some themes that we're all reinforcing. And so I'm going to speak from my perspective and from Be Strong Families' perspective. My number one lesson learned is resist entropy. And what I mean by that is, from the beginning of the pandemic in March, what I felt and what I saw was energy being dispersed and people being flung to their own resources, hunkering down, isolated. And that seemed like a real danger to me, increasing pressure in already stressed families and communities and weakening social connections that are an essential part of informal safety nets, increasing alienation and isolation. And so what I've learned from the pandemic is that we need to sustain and continue to build community. This is part of essential services. Things that build community, things that help each other stay strong, those are part of essential services. And that was the insight behind Be Strong Families starting to offer free daily webinars by the community for the community, 5 days a week in both English and Spanish. We've been doing that for the past 6 months, and we still have 50 to 100 people coming every day. Why? Because people, including our staff, including members of the cafe community of practice, needed a magnet. They needed a place to gather in the middle of the day to provide structure when there wasn't any, to talk about what's going on, to share what's on our hearts and minds. It was a small thing, but it's representative and symbolic. We also provided free training to all those we'd trained on in-person parent cafes to take their cafes online. And I say this because I want to add that we didn't get any additional funding to do this, and nobody told us to do this, and I didn't ask anybody for permission to do it. I point this out because I think that a lot of nonprofits have a habit of being constrained by funding sources, and often there's much more latitude for creativity than we acknowledge. So this is the flip side, the down and dirty side, what Kaylin was saying about systems changing their rules. There's also a lot that we can do without rule changes and without policy changes. We can think outside the box and give ourselves permission to do what needs to be done. And I think that lastly, what has been amplified in the pandemic for me is that we need to be kind, and we need to be ready to drop everything and be there to listen and to respond. Because catastrophe is emergent and emerging everywhere. One Be Strong Family staff member has lost 13 people in the last month. Several are dealing with seriously ill parents going into hospice and dying. I'm only using this as an example that life continues to happen during the pandemic, and it is happening all around us. And these people, staff members, are continuing to work and continuing to serve. But in order for people to keep going, they need copious amounts of love. And we need each other, and we need to keep each other strong. That's the heart of family support. And it's also a core part of family support to be creative and responsive to emergent needs.
Thanks, Kathy. I think it's just such a strong reminder about taking care of ourselves and each other through all this. I think that is one of the things, that the passion and the responsiveness is just really wonderful, but also recognizing there's a tremendous amount of grief and loss that's also happening for many people on many levels that we might not even know. So thanks for bringing that up. I'm hoping that everyone is also chiming in on the Google spreadsheet with your lessons learned. I think what's exciting about this forum here is there's so many of these great ideas. And I think at one point, Kathy, you said this was a little thing to hold. I don't think that's a little thing to hold daily webinars. I know that Decoria has been involved in many of those things. That's so important and it's so critical. So I definitely would not want to minimize that. The next part of this conversation, and I think all of you have started to allude to this, is obviously we have to do something better. We have to come out of this better than we were before. I think one of the things that I've heard, at least in our office and the federal level and the funding issues, it's like, how can we provide more flexibility to the state and local level that are receiving these funds to do what they need? That's definitely also critical. And what's been interesting is, in this short amount of time, things that people thought couldn't be done, you know what I mean? Oh, looks like you can put that out in a couple of weeks or that kind of thing. So we all have to push ourselves to do that. But taking those lessons learned, then we want to ask the panel, how do you envision the future then of family support? And I want to turn to Debra to kind of kick us off with some of the things that she's been thinking of.
Thank you. I think for me, the word of the last 6 months is pivot. We've all had to learn to do things more creatively, how to think outside of the box, and adjust the way we are working. So for me, we've had to do that pivot. We lost funding right at the same time from our state or provincial funding. We had a big cut in our place, so I had to lay off some staff and deal with COVID at the same time. But we learned to use our volunteers who were experts in certain fields. We picked up the phone. As I heard people saying, we connected with people and how they were doing. And this received overwhelming gratitude. And I think we deepened relationships by reaching out first and not waiting for others. I'm grateful for everybody who helped step in those early weeks to make us viable and responsive. As an agency, we still have a lot to learn about web hostings and webinars and how to do panel discussions and how to do safe social distancing for people when they are in our center to connect. Some of us have returned to the office and many are continuing to work from home. We've decided to do a hybrid of both just because many of our vulnerable families aren't comfortable in this digital world. So their preference, if they have to talk to somebody, is to be there. So we're working on all of that, and of course, in a safe manner. I believe that the pandemic is going to shift the way family resource centers work in the future. We will continue to work from home, and it's going to be part of our daily lives. I think the way we organize our professional and personal lives are going to be impacted. I'd like to kind of close off at this point and thank everybody for teaching me a little bit over the last few days. I've learned in some of the small discussion rooms and that you had the ability to share. It is about connecting, both on a personal level for our families, but on a professional level. And I am grateful for the time that you have given us. And I look forward to implementing a number of the concepts and ideas into Calgary, Alberta, and beyond. So thank you, everybody. This has been just a pleasure.
Thanks, Debra. Helen, do you want to share a little bit about what you're seeing for the future?
Sure. I have two main thoughts about the future of family support as we come out of this pandemic, hopefully sooner rather than later. The big picture one is I feel like our family support field is more and more recognizing the need to change the circumstances that families live in, not just help them cope with the circumstances they live in. So we want to acknowledge the barriers that a lot of people face, and that those barriers are different and often worse for families of color in our society. We also want to acknowledge the resilience of so many people who have overcome those barriers, and the generational resilience we see in our Black community, in our Indigenous communities, and Latinx communities, of people who have been resilient and have been able to thrive and help their children thrive despite all these obstacles. But like, let's stop having so many obstacles, right? Like, let's figure out how to make it that everyone doesn't have to be totally resilient to get by. And so I think we're thinking more about financial systems and how we support families and what neighborhoods look like, and just really expanding how we think about family support to be not just about individual service delivery to help you manage your challenges. And once we have, lift everybody up with having basic needs met, then we will have so much more freedom to look at positive parenting and, responding to each child's unique needs, and all of that will be so much easier when basic needs are met. The other thing I wanted to say was, I think in the field, we had this big pendulum swing towards evidence-based programs. And I think where that pendulum is going now is a little bit more targeted to saying, let's be really specific about what works for whom and why and how, so that it's not everybody needs this particular evidence-based program, but more, we know this works well for a family in this particular circumstance, and we can tailor it and be much more responsive. And I think that also gets to some of the anti-racism work of saying, like, what works best, not for the average, but for someone in this particular, with this background and this language and this immigration status and this family structure and all of these things. Let's figure out how to help them the best we can. And our evidence-based programs are starting to have that information about who it really works for. And then sometimes we can say, we don't have something that works really well for a particular group. Let's go back to the drawing board and figure out what that is. So I think that's the direction we'll be moving, I hope. And that's something that was unrelated to the pandemic, but I think as we forward, it'll make sense for everybody anyway. So that's what I want to share for the future. Thank you.
Thanks, Kayla. And I know Mark's been also thinking about some of these related themes about evidence and family support networks and services. So,
yeah, I definitely think that part of our future is more evidence-based and research-informed trainings and practices offered to families. An example of that is the FFPSA, the Families First Prevention Services Act. You know, you don't get that money unless you have an evidence-based program. And it's rough. You know, we know that we're doing good work with families, but we're going to have to show more and more funders and systems. We're going to have to prove that we're doing good work. I think the utilization of common tools, common trainings, common methodologies that are recognized best practices is really going to be part of that. Frankly, that's one of the reasons why we're a member of the national network, is so that we can utilize the standards of quality, so that we understand what best practices in our field are and replicate them in our state. And I think more and more stakeholders are going to want to see that. What that means to me is we're kind of professionalizing our sector, right? We're using some common tools and standards. I think we need to match family support prevention-based services with single issue government or nonprofit organization silos and intervention systems. We see our hunger networks wanting to work with us. We see our social determinants of health and hospital networks wanting to work with us. We see our child welfare system starting to want to work with us. That gets to the question of what comes first, family support and strengthening, or those individual. We track 14 domains that make up family support and strengthening, and they similarly track social determinants of health. But we think family support and strengthening is right in the middle of that wheel. But having strength-based conversations with our partners to make sure that we're all working to the same end goal, which is more healthy families. So we're really making inroads to partnering with all those kinds of partners. By the way, a big one for us is shared data. We keep data. We have our Colorado Family Support Assessment. We also utilize a Salesforce program now to track outcomes with families. And we can show that our outcomes are good and that families are progressing to more self-reliance as they work with our family resource centers. But now as we work with other networks, because that's part of the future, our network's going to work with other networks, not just other silos. How do we compare data? You know, can our data systems talk to each other? Can we share data in a way that we can each understand it? And somebody mentioned this earlier, but I think it's going to be huge. Outreach to the underserved, and primarily, you know, that's an equity issue. So many parts of our society are underserved. We need to solve that problem. Frankly, we're being asked to prove that we're outreaching to those types of communities and working with those communities as much as possible. So we're having to pivot, and we're having to learn more about it, and we're educating ourselves so that we can work with other systems and other populations and bring our, what we think are best practice common tools and technologies and methodologies to that, but really make sure that we're relevant.
Great. Thanks, Mark, and appreciate the comments too. I mean, I think, you know, even with this desire, definitely for evidence-based, I think evidence-informed, we had these conversations with our child abuse prevention programs that there needs to be room, right, for the evidence-based, but also the emerging and innovative programs and strategies out there that are trying to build that evidence base. And I think that's at the crux of a lot of the creativity and flexibility that family support programs bring. And appreciate that using data for learning and improvement and partnering with, I think the researchers, I see those chats in there, completely agree. It's about how do we learn together. And actually we had some conversations, and I think some folks from are on the phone earlier, is like learning also with parents, you know, having them really understand the data and what that means and the power of that data that gets tied to, you know, funding ultimately later, right? So that's some of the things, the resources that we need.
Well, and don't get me started on this too much, but if you really want to bring it to a screeching halt, ask them if they're willing to help fund it. You know, if we're going to be asked to build those systems and compare data with other people, where's the funding for that?
Yeah.
There's not much.
No, thank you. It's an important point. But I definitely want to, I know from Kathy's perspective, when the work they've been doing with Be Strong Families, would love to hear, you know, what you're thinking about then too with the future. So. Oh, and you're still on mute, Kathy. Thanks. There you go.
It's not like me. Maybe I did myself, so I won't. But you're
You have a
welcome.
lot to want to say, so it's okay.
I'm going to be intentionally provocative and also maybe a tiny bit revolutionary. I think that the future of family support lies in two things and that they're related to each other. I think one is eliminating white supremacy in the form of white organizational culture from all those organizations and programs providing family support services. When I say that, I don't mean eliminating hatred and bigotry, because I don't think we have a lot of that here. I mean the received and persistent structures that privilege white people and white cultural ways as dominant or mainstream culture. So you can just look at the composition on this panel, and what do you see? You see the organizational representative leadership is overwhelmingly white, and the parent community perspective is represented by a person of color. That's not an accident. And it hasn't substantially changed at gatherings like this in the 30 years I've been in this field. Including parent voice is essential, and this started in the early 1990s. We have to go beyond this. We need the will to get serious, and we white people need to share our privilege and our power and put it behind efforts that surface and eradicate systemic racism in favor of multicultural structures that value, include, and weave together everyone's talents. There are a lot of ways to begin calling out and dismantling systemic racism that go beyond semantic discussions, like whether we say cultural humility or cultural competence, like whether we say lens of equity or we say something else, to concrete action steps. So using my voice to raise awareness of the issue with respect to a specific example, like the composition of the panel, is a concrete step. But what does scripture say about words without deeds? Some even more concrete steps an organization can take beyond saying that it is anti-racist and getting down with the cause is to do an equity audit of your HR policies. And then change your policies accordingly, such as, do you have a bereavement policy that specifies the family members for whom one is entitled to take time to mourn? If you do, that's an example of white organizational culture, because many cultures have kin-like relationships with people that are as important to them as blood relatives. We heard from Ms. Lynetta this morning about things like not just consciously hiring and promoting so that your leadership teams and governance structures include people of color, but authentically sharing power, including having your evaluation of your program ensure accountability to the participants and letting them tell you how you're doing, instead of just kind of gathering up what they have to say in order to get more funding, that we're serving this many people and we're pleasing them. So the second and related thing I see for the future of family support is moving in the direction of mobilizing mutual assistance. This is part of the original principles of family support practice. And mutual aid societies have a long history in this country back to the turn of the 20th century, when poor and working class immigrants and immigrants historically provided more aid than any other institution, public or private. So think of Workmen's Circle in New York City, Chinese mutual aid associations, Jewish organizations. In New Orleans around 1900, there were 135 all-Black mutual aid societies, 40 of which were oriented exclusively towards Black women. I'll put an article in the chat if you're interested in reading about mutual aid. But that family support should follow in the tradition of mutual aid is not a pipe dream, or it's not my revolutionary idea. Formal family support has roots in settlement houses and neighborhood collaboratives. 30 years ago, we were highlighting Dudley Street Neighborhood Collaborative in Dorchester, Massachusetts, Mid-Iowa Community Action. And there was a workshop today by my friend and mentor, Yolande Trevino, that was about how the Pasadena-Altadena Coalition of Transformative Leaders provides family support. In that model, in the Los Angeles area, the community leads and the community provides for its members, with the professionals in a supportive, facilitating role. For example, when they delivered 3,000 pounds of food per week during the pandemic, the people delivering it were the families receiving it. During COVID-19 in the same area, some of the more traditional, formal social service organizations were stymied and felt powerless and overwhelmed because their service methods did not allow for the quick pivot. So I think the future of family support is a paradigm shift that has professionals putting their energies behind community efforts to keep each other strong, where community is not limited to specific cultures or races or ethnicities like the mutual aid of the olden days, but where community is diverse and inclusive. And we see ourselves at Be Strong Families as part of that shift. We're known as the go-to organization for parent cafes, which are provided in many places by family support programs as a parent engagement strategy. They were developed by parents for parents, with program staff experts in advertising and experiential education in supportive roles. And they are events where everyone's voice is equally important, valued, and heard, where everyone is accepted, and where peace is kept by agreement to listen to each other and learn from each other. Cafes give all of us an experience of what the new paradigm will feel like. It's not the be all and end all, much more is needed, but it gives you an experience of what it feels like. So I think we could do so much better if the family support field pivoted to being by the people for the people. And I think that as a sustainability strategy, reorganizing and reinventing ourselves in this way would facilitate the changes that the others on this plenary are proposing.
Wow. Thanks, Kathy. Very powerful set of statements in charge. And I'm going to turn it over to Takoria to really round out what do we want to do? What do we want to see as our future? Takoria.
I'm going to do my best, but I'm still processing those wonderfully strong and encouraging and timely, appropriate words from Kathy. Thank you so much for that. Just to give you a little background on myself, I'm a voice of multi-systemic, multi-generational hard knocks. And I really don't know how to say it any better than that. So what I see as the future of family support, there's a couple of things, and a couple of them already been mentioned. Inclusivity. All families need help from time to time at some point. And to me, that looks like prevention, and that is prevention work. So being inclusive to all families and really getting into the prevention. Wraparound connected services, that really needs to happen. And guess what? FRCs are doing it. FRCs are working. Right, Andrew and Julie and Mark and every other state and province that has access to these centralized family centers, they work. And they work very well. But what is not working are silos. So let's work smarter. There's no need to keep doing the hard work. It's time wasting. One of the biggest things I like to say about the future of family support is centering around families where we are, based on where we say we are. Every community, every family is different, and we appreciate your outcomes, but I'm a person. These families and communities are people. We are not numbers on papers, data structure. You know, at the end of the day, at the beginning of the day, actually, we are people. We are people just like you, and you all have families just like communities and all that good stuff. And at this point, I'd have to say that there's a little bit of a difficult conversation that I'd like to have right now. Most agencies and agencies and organizations are serving what? Here today, most of you are serving marginalized communities, correct? As you come into our communities, do you recognize our needs as equal, and do you recognize our strengths equally? Do you recognize our gifts equally? You see our needs, you know we're marginalized, you know the story. But when you come into our communities, are you only seeing what you want to see? Are you also seeing the gifts? Are you also seeing the strengths? Are you making that as much of your focus as these needs and these services that you want to bring to us? Are your agency's intentions to serve us and equally respect us? Because service is an outcome if it's not with authentic personal connection. And again, we are people. You are people. Let's make that happen. Faith communities, faith leadership organizations are definitely important. Christians, Muslims, Baha'i, Hindi, everybody, there's families in every religion. But I do want to use that point to say that the business leaders and community leadership organizations, they must be in this as well. They must be right beside us as well in bringing this future of family support as we see it together. What if the bike club is the leadership community organization? What if the barbershop guys are the ones who know what's going on? You know, what about the moms at the bus stop? They know what's going on. Would agencies be willing to look in other places for leaders? You're going to have to, because you know what? To do this work, parents have to be equal, or it's not going to work. We have to be at the table. We have to be at the table from the beginning, or it's not going to work. And that's a hard piece to kind of process sometimes. But again, centered around families where we are based on where we say we are. And you cannot know where we say we are if you do not have us in the process at the table every time. I'm going to drop in the chat when I'm finished with this little a little brief that some parents did. I hope you have a opportunity to check that out. But I do want to say also shared language, again, the protective factors changed my life. I cannot put it any simpler than that. They really changed my life because I could not know better. I could not do better until I knew better. And the protective factors showed me better. So there's this one little, that in my envisioning of the future of family support includes celebrating. We have to celebrate. We have to celebrate each other. We have to celebrate where we are, what we're doing, the small steps. One session may have had 3 parents. The next week you had 5 parents. That is a celebration. This week, parent A did not say anything. 2 weeks later, parent A is talking so much, they brought parent B. That is a celebration. So please do that. Please celebrate all of that when you are working in families and communities. But I do want to ask one final question. As you come into marginalized communities intending to serve, is your intention, you're not saving us.
No.
You're not being paternal to us. You're not teaching. We're not children. You know, you don't have to make decisions for us. Are you policing us? Because that's not what we need. Protect and serve, that's a whole nother conversation. So I'm gonna have to leave that right there. But just do think about that, because we know you come from a community as well. You come into the marginalized communities, we see what you say, what you wear, what you drive, what you got going. We see all of that. So please do know that you come with your community attached, and you're not gonna be able to take off a hat. It's time to be authentic. It is time to bring your whole self to your work and not be a parent sometimes and a professional when you're talking to parents. It is time to be 100% you, and if you're not authentic in your work, it's gonna show, and the people you're trying to serve are gonna call you out as fake, or they're not gonna be involved in your programs, and that's just the truth, the absolute truth. But to go back to the celebration, there's a little piece, and I hope I have enough time to share this with you. And if we can't bring it up, then, oh, here we go. So if you know the words, please sing along.
This the light of mine, I'm gonna let it shine. This the light of mine, I'm gonna let it shine. It's the light of mine, I'm gonna let it shine.
Excellent. Thank you, you brave souls, for singing along. And I want to end that on this, you know, that we all have a little light. And the next verse, I believe, is all over the world, let it shine. So from my community to yours, keep your little light lit, stay lit, and be authentic in your work.
Wow, thank you, Takoria. I don't know, I can't really say, I think that's like the perfect, I don't want to say anything else because that is like an amazing way to sort of share this conversation. I know I want to check in with Kaylin because I think we were going to see if people had questions. You have a lot of fans. I think every single person on this panel have all these wonderful fans and great reactions. And I know there's stuff on the Google Sheet that people were also saying and sharing, which I really appreciate. But I'm sensitive to the time and it's Friday. So check you guys.
Yeah, thanks, Melissa. I just pulled up the Google Sheet in case anyone hasn't been able to access it yourself. You can see here that people have been typing in their thoughts on the same questions that we answered. So the first column in purple here is what's one lesson you've taken from the response to the pandemic that should shape our future, our work in the future, and then how do you envision the future of family support? So I know that we don't have a lot of time to look through all of these, but I do see some of the same themes that that were all mentioned on the panel. But I also, a couple things I'll shout out, and maybe others on the panel want to mention things that they noticed. I noticed someone wrote, family relationships are crazy important. We need those outside of our homes, and we also really need skills to live together in our homes. And I think that is really true. You know, people who maybe in the past thought, oh, if only I had more quality time with my kids or spouse have been saying, okay, enough with the quality time. A lot of time together, and that is something that we do need to help families, you know, learn to do more together time, and also to maintain their connections with the other people outside their homes who help them in so many ways that we know is a protective factor as well. I don't know if others want to jump in. And the other thing I'll say is if you have any questions for the panel, you can type them into the chat box. We do have a few, we have some time to answer questions. Anyone else want to comment on things you see in the Google Sheet?
I was interested. Am I muted or not?
We can hear you.
Okay, so there was a question about succession planning that I think from Missouri, Dr. Jumesha Wade asked. And I would love some clarification on what she was asking. Please show us your succession plan. Who is the leadership pipeline? Organizational change doesn't happen by accident. And I was interested. I was interested in that.
Yeah. So thank you for your being on this panel and just all the great information that we've had. One of the things that I often think about is we're asking white leaders to, you know, to make sure that there's other people in the pipeline, and we still see that that's what is represented here. What is the plan to actually change that? Are you stepping down? Are you creating a pathway for others to be in your spot? If you think 5 years down the road, 2 years, you know, what does that plan actually look like? Because I don't see a lot of people just readily giving up a position such as the ones that you all hold. So not you specifically, but just, you know, everybody. But if you have specific insight, that's awesome as well.
Yes, I mean, specifically, we did hire a chief program officer, Alexandra James, who is with the explicit goal that she would be trained to replace me in a matter of years. We haven't said, you know, how many years that's going to be. And
yeah,
and I guess I would also say that I think that in the vision I have for the future, there is room for all of us, and there is room for all of our talents and all of our hard work and all of our brilliance. And I'm not saying that white people shouldn't be part of the part of things in the future. I am saying that I think already right now in the family support field, there are leaders of color that could have more prominence. I know there were 25 years ago, so I can't imagine that that's not true. So I think some of it is about giving people more that are already in leadership positions more airtime.
Thank you. That's very helpful.
I can respond to that on behalf of CSSP to some extent as well. We're an organization of about 50 staff people, and I think we're roughly 50% of us would identify as white. I'm not entirely sure on the numbers, but about half white and half people of color, wide range of different backgrounds. And we have for 40 years been a white-led organization, and our longtime president retired at the end of last year. We did a nationwide search and ended up with our longtime executive vice president stepping into the role of president, Judy Meltzer. And I think that was because we didn't find the right person, and the right person needed to include not only embodying everything that CSSP has been and being ready to take us to the next phase of our organizational development, but also representing a marginalized group of some sort to not continue being an entirely white-led organization. And I shouldn't say entirely white-led, just that very top level. We do have increasingly and intentionally more diversity in our executive leadership group. And I think with the way that 2020 has gone, we're all happy to have that continuity of leadership from Judy Meltzer, who had been planning to retire and chose to stay on a bit longer and didn't know what she was getting into with what 2020 has brought. But you know, that continuity has been good, but at some point before too long, we will be starting that search again, and that intentionality is there to continue building more diversity into our organization from all of our staff and up to the top leadership.
And Caitlin, if I could interject here, and I hope I'm coming through okay. There were a lot of white allies in the civil rights and the slavery and voting, and their stories were probably the most hidden, the most redacted, the most kept quiet stories that we don't know. So I just, you know, there were people who lost their lives, that we had white allies in America and in other countries where there were, you know, issues in society, that there were always allies who looked different from the people who were dealing with the hardship. So please do remember that. And because of that, you know, you have a very strong place to move these things forward and to be that voice, and to strongly be that voice, and to be that voice unwaveringly all the time, as loud as you can, because that's the right thing to do. And this is the right thing to do, and doing it together makes us strong. And we are all going to you know, think about the little pieces, and if that is knowing who the white allies are, and appreciating the work they're doing, and knowing that they are opening doors and bringing down opportunities that would not otherwise happen if it weren't for the face that they have, or the people that they know, or the words that they can say in a certain situation. But I do have a lot of trust, and I think that is another word that needs to go along with love, is trust. Agencies trust communities, communities trust agencies, and we need to trust each other to work together.
Yeah, I totally agree with you, Tokoria. And I think Dr. Carol Mizuguchi, who's formerly at Casey Family Programs, working in the city of Alexandria right now, introduced me to the idea of different degrees of allyship, which I think is another thing that we need to make it complexify things, if that's the word, so that it's not just you're an ally or you're not an ally, but that there are degrees of allyships, and how you put yourself out there and what you do is as an ally, or somebody who wants to be an ally, is important.
Small but significant.
Well, and
small but significant.
Yeah, and sometimes large. I mean, it depends, you know, as you say,
absolutely,
their lives, and people, I mean, people have had, I mean, I'm thinking now of, well, I don't want to go there. Never mind. I'm Jewish, so I was going to go to the Holocaust, and I was going to talk about righteous Gentiles who hid Jews in their basement, and the punishment for that was death. So, I mean, those kind, when you said around the world, things have been like that. That's true also. In liberation movements, it requires a lot of all of us.
And also, I think you have to make sure that boards also understand this succession issue. I've seen more than one occasion, at least in the nonprofit sector, where a long-term executive director signals a desire to begin to step down or get out of the way, whatever you want to call it. And you know, instead of having a 1 or 2 year path to do that, the board lets them go almost immediately, creates a crisis of leadership, and things don't necessarily improve at a time like that. And I'll adopt Takoria's safe word. You know, people need to feel safe in saying, hey, listen, we need a succession plan here, and that includes me being able to work my way out of a job. That's a hard discussion to have.
I'll just pick up a little bit from what you're saying. Here in Canada, I think, at least from what I see, most of our family resource centers are reflective of the communities that they're operating in. So for us, we have a lot of people from different cultural backgrounds. We don't have the same issues that you're having in the South, in the United States, but we have a lot of people from different cultures. I myself am the only white Caucasian person in our agency, and which you think, yes, I'm in a leadership role. I'm on the tail end of my career, and I find that the people that I've got working for me that are working front line with our families, they're the ones that are connecting, who come from really diverse backgrounds. Many speak many different languages and have a lot of world experience. So, you know, we've been very fortunate to have people in our agency come on with that. But for succession planning, I'm finding in my office, when I talk to the people who are doing such great work, they don't have the confidence right now. And it's taking a lot of time for me to sort of convince them that they can do this work. So they're still needing some more mentorship and some, I've been doing this for quite some time, but they're a little more reluctant to step into some of these roles. So I don't know how to make that happen quicker, perhaps, but I know I do have a great staff that are reflective, speak multicultural backgrounds and many languages in our center. So even our board chair is the member of the LGBTQ community. So diversity looks different in very different communities. So yeah, it's not always just the white skin color for us, but it's any marginalized community that we're working with.
Great. Well, this is just such a powerful conversation, and I think there's so many implications on many levels for obviously continued conversations and things. I will just say, I think what I stick to around, there was a lot of really wonderful pieces around what to do for the future, but I think I'm going to quote Takoria and saying, this is the right thing to do. You know, it's just the right thing to do. So I think of all of us just see what we can do and be kind, you know, take care of each other, challenge ourselves, push ourselves, but also do the right thing for each other and our families. Then we at ECD are really looking forward to partnering with folks on that. So thanks. I will turn it over to Kaylin. I know there's a raffle to
yeah,
pay.
We can hand back to Julie. Thank you so much for facilitating us, Melissa. That was wonderful. And thanks to everyone who chimed in.
Yes, thank you so much. I'm gonna share my screen here real quick. All right. Well, thank you everyone for sticking around to the very end on a Friday. So that raffle that we've talked about throughout the day and throughout the conference, When you complete your evaluation, you are entered into the raffle for a chance to win some of these tasty and delicious items that we have up for raffle. So all of them do have a tie to our wonderful virtual host state of Georgia. So share more specifically in just a second, but want to share out our